Before using Xarelto 1 mg per milliliter oral suspension, make sure to read the medication guide and instructions for use provided by your pharmacist. If you have any questions, ask your doctor or pharmacist for clarification. Take this medication by mouth as directed by your doctor, usually 1 to 3 times a day. Follow your doctor's directions for taking this medication with or without food. If your brand of medication is stored in the refrigerator, allow the suspension to come to room temperature before giving each dose. Do not warm up this medication any other way, such as by heating in the microwave or placing the bottle in hot water. Shake the bottle well for at least 10 seconds before each dose. Carefully measure the dose using a special measuring device/spoon. Do not use a household spoon because you may not get the correct dose. After each dose, drink/give some liquid to make sure all of the dose is taken. If you or the child spits up or vomits less than 30 minutes after taking the dose, take or give another dose. If this happens more than 30 minutes after the dose, do not take or give a new dose. Take/give the next dose at the usual time. If you are giving this medication through a tube into the stomach, nasogastric or gastric tube, ask your healthcare professional for detailed instructions on how to properly mix and give it. Do not increase your dose, take it more often, or stop taking it unless you are told to do so by your doctor. The dosage and length of treatment are based on your medical condition, weight, and response to treatment. Use this medication regularly to get the most benefit from it. To help you remember, take it at the same times each day. If you experience easy bruising or minor bleeding, such as nosebleeds or bleeding from cuts, be sure to inform your doctor or pharmacist. It's important to remember that this medication has been prescribed to you because the benefit outweighs the risk of side effects for you. While many people do not have serious side effects while using this medication, it's important to be aware of the potential for serious bleeding. If you experience signs of serious bleeding, such as frequent nosebleeds, unusual tiredness or weakness, or prolonged bleeding from cuts or gums, seek medical attention right away. Additionally, if you notice vision changes, confusion, or weakness on one side of the body, it's important to seek medical help immediately. And in the rare event of a serious allergic reaction, such as rash, swelling, severe dizziness, or trouble breathing, seek medical help right away. Be sure to contact your doctor or pharmacist if you notice any other effects, and report any side effects to the appropriate medical authority in your country. Before taking Xarelto, make sure to inform your doctor about any allergies you may have and any other medications you are taking. It's important to also share your medical history, especially if you have conditions such as liver disease, kidney disease, or a history of bleeding problems. If you are planning to have surgery or any medical procedures, let your doctor know that you are taking Xarelto, as they may advise you to stop taking the medication temporarily. It's important to follow their instructions carefully. Xarelto may contain sugar or aspartame, so if you have conditions such as diabetes or phenylketonuria, talk to your doctor about using this medication safely. Limiting alcohol consumption while taking Xarelto is important, as it can increase the risk of stomach bleeding. It's also important to be cautious with sharp objects and activities that may cause injury, as Xarelto can increase the risk of heavy bleeding. If you are an older adult, you may be more sensitive to the side effects of Xarelto, particularly the risk of bleeding. It's important to discuss the risks and benefits of taking Xarelto during pregnancy and while breastfeeding with your doctor. It's important to be aware of potential drug interactions with Xarelto. Some medications, such as mifepristone and certain antidepressants, can interact with Xarelto and may increase your risk for serious side effects. It's crucial to keep a list of all the products you use and share it with your doctor and pharmacist. Other medications, like certain antifungals and HIV protease inhibitors, can also affect how Xarelto works in your body. Additionally, if your doctor has prescribed low-dose aspirin for heart attack or stroke prevention, you should continue taking it as directed. Always consult your doctor or pharmacist for more details on any potential interactions. If you or someone else has taken too much Xarelto and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical help by calling 911 or a poison control center. Symptoms of an overdose can include bloody or black stools, pink or dark urine, and unusual or prolonged bleeding. If you're in the U.S., you can call your local poison control center at 1-800-222-1222, and if you're in Canada, you can call a provincial poison control center. Always seek medical attention if you suspect an overdose. It's important to remember that this medication should not be shared with others. During the course of taking this medication, you may be required to undergo lab tests or medical examinations, such as hematocrit/hemoglobin and red blood cell count tests. It's essential to attend all scheduled medical and lab appointments. If you miss a dose of Xarelto 1 mg per milliliter oral suspension antithrombin agents, here's what to do. If you take it once a day, take the missed dose as soon as you remember on the same day. If you remember the next day, skip the missed dose and do not take double the dose. If you take it twice a day, take the missed dose as soon as you remember. If you miss the morning dose and it's close to the evening dose, you may take both doses together. If you miss the evening dose, take it as soon as you remember on the same evening. If you take it 3 times a day, do not make up for the missed dose. Just continue taking the medication every 8 hours for the rest of the day. And the next day, continue with the regular once, twice, or 3 times daily schedule as directed by the doctor. When it comes to storing Xarelto 1 mg per milliliter oral suspension antithrombin agents, it's important to follow the specific instructions provided by the brand you're using. Always keep medications out of reach of children and pets. Remember, never dispose of medications by flushing them down the toilet or pouring them into a drain unless instructed to do so. Instead, properly discard the product when it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for guidance on the proper disposal of this medication. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.